So Dr. Anini, thank you for joining us today. We have some questions for you about MS. What is it exactly?
Well, MS is an autoimmune disorder. It's a chronic disorder that affects certain people, in which case the immune cells of your body attack certain components of the neural cell, mainly the myelin or the cuffing of the nerve cell. And it creates different symptoms, and it requires particular treatment to lower the immunity that is attacking the nerve cells.
What are some symptoms of MS?
Well, they're quite variable. The most common symptom is numbness, but many other people have numbness without MS. Numbness is one of the symptoms of multiple sclerosis or MS. Also, you can have visual loss, you can have double vision, you can have trouble speaking, weakness, trouble walking, and some difficulty of thinking and some cognitive deficits also as well.
And how is it diagnosed?
That can be very tricky. Generally, the diagnosis of MS is based on certain criteria. There are different kinds of criteria out there, so the neurologist has to weigh in a lot of factors when addressing whether the patient has MS or not. The main component of the criteria is imaging, mainly MRI, magnetic resonance imaging, and also the examination, and sometimes requires examination of the spinal fluids, what's called lumbar puncture. Lumbar puncture does not have to be done in all patients, but some patients may require it to be done.
And what types of MS are there?
There are different types of MS. The most common one is called relapsing remitting multiple sclerosis, and those are the patients that just have attacks over the years. The second type of multiple sclerosis is the secondary progressive multiple sclerosis, and those patients have attacks, and at the same time their baseline worsens over the years. And there is a more rarer or less common type, which is primary progressive multiple sclerosis, and the primary progressive patients have generally a slowly progressive course, but that is not a very common subtype. And there are other kinds also. There's a kind called mild MS that in which case patients really have a very mild course and don't have any worsening at all.
Okay.
So we'll be talking, I guess, more. We'll be chatting about more details in future videos that will be coming up.
Okay, sounds good.